elect a new chairperson due to the fact that our chair and vice chair, their appointments both lapsed. They've been reappointed though to the committee or board, I should say. So I'm going to turn it over to the clerk, and she can proceed with the election, call order, proceed with the election of a chairperson.
Thank you. Good morning. I'll call the roll, please. Joe Brodka, Paula Hodak, Robert Kopish, Patricia Stephen, Dennis Warko is excused, Sally Hummel, Suzanne Acker is remote,
Here.
and Gerald Swenson. Thank you. So items for discussion and possible action. I'll lead the election for the Health and Human Services Board chairperson. After that, the chairperson may run the election for the vice chairperson and the remaining of the meeting. So number one, elect vice chair. Do I have any nominations for the chairperson?
I'll second.
Are there any more nominations? I have one nomination for Paula Hodak. Are there any more nominations? At this time, I would recommend a motion to cast a unanimous ballot for Robert Kopish. Or not, sorry, for Paula Hodak. Sorry, Bob.
Which one?
We don't either.
That's what happens when you don't pay attention.
I have a motion for Paula Hodak for the chairperson. Do I have a second? Second by Gerald. All in favor? Opposed? Congratulations. Motion carried.
Okay, thank you so very much to all of you again. So now we'll go ahead and open the floor to nominations for vice chair, vice president, vice person.
I would nominate Bob Kopish.
We have a nomination for Bob Kopish. All right, any other nominations? Looking for maybe a motion to cast a unanimous ballot.
I would, I'd second that.
Okay, motion for a nomination be cast a unanimous ballot for Bob Kopish. Paula Hodak. So, in a second, all those in favor? Aye. Those opposed? All right, Bob, welcome back. I just recommend everyone to make sure you use your microphone when you do that. All right, items for discussion. Let's see, we're moving on to public comment. Is there any public comment at this time? Anyone online? Nick? Does it look like all county? Okay. Star 6, is that what they, somebody just came on? Okay. Okay. All right, seeing and hearing none. Anything from communications from the board? Any comments? Okay, hearing and seeing none, we'll pass that on. Thank you. Vouchers, they should be going around. I believe Bob has some questions for you. For Sam? Is that right? Patty does? I saw a hand over there, so.
We're just noticing Great Wolf Lodge and Restitution. Not together, but
Oh, okay.
separate.
So Great Wolf Lodge. I was gonna say. So Great Wolf Lodge was for training for the Human Services Financial Management meeting in
Okay.
May.
Okay.
And restitution, that's just payments that children make for damages they've done to property or whatever. We get the payments, we pass them on to the victims.
Okay. Gotcha. Thank you.
Is Great Wolf the old Trago facility over there, or where is Great
It's in
Wolf?
the Dells.
Huh?
It's in the Dells.
Where? Culver's where?
Wisconsin Dells.
Wisconsin
In the
Dells.
Oh,
Dells.
okay, all right, thank you.
The Uno, the Wisconsin
Good place to
Dells,
take your grandchildren.
Down from the
Yeah.
Kalahari.
Yep.
Okay,
Expensive.
and I sent Chris Ann a little note this morning.
At 5:38.
and She spent all night waiting for it to come, and it came. So if
No,
you
she
could
didn't.
just
She
go
was
through what
sleeping
I
and not
what I
working.
sent you, I would appreciate it.
I'm sorry.
You can just go through what you
Okay.
got there.
So
Thank you.
I'll have Kayla explain. There were a couple questions on our bills for Forward Home for Boys. This month we had 2 sets of vouchers because we were doing payments for in May and June. So the Forward Home for Boys bills were both over $15,000. And so that's a group home for a teenager. And then the Family Services of Northeast Wisconsin is a residential care center for a delinquent juvenile. And Kayla was just going to explain a little bit about these costs and what goes on with that.
Hi. So Forward Home for Boys, like Christiane said, is a group home placement, but it's also QRTP, which is a qualified residential treatment program placement. It's a higher level of placement, so it's much more expensive than a typical group home. And the reason for that is the level of care that they provide. And I would have to give a plug for this being one of the best placement facilities that we've ever found as far as a group home or as far as a group home setting goes. So the normal cost of that is $360 per day just for the group home setting, which is about $11,000 per month. But then there's an extraordinary rate for this youth in particular, that's $6,000-ish. This youth does require that much care. They've had to hire on another staff member to be one-on-one with this child, and at times have still been like, we don't know if we can handle this. The worker will take calls at night, on the weekends, whenever they need to provide support to this group home, because otherwise I don't think they would be able to keep this youth at the level of care that he needs. So that he makes a lot of lots of threats, lots of behaviors that just would not be manageable in a lesser restrictive placement. And that's why it's so
Yeah,
expensive.
and this is 3 months now that we've had this at
He-
17,000 a month,
Ah,
been there since August, I think, of 24.
and it may go on till October.
the good news for Price County, this could go on forever. We'd like to find a lesser placement. He does not have an appropriate family member. There's no place for him to go as far as home goes. If we did try to move him to a less restrictive placement, he would likely bounce from place to place to place because they would not be able to handle him. He makes, like I said, he accuses a lot of things that have to be looked into a whole lot. Accuses sexual abuse of residents, staff members. So it's not just a one-on-one; it's a two-on-one because you really shouldn't be alone. And so they're being able to manage his behaviors. But here's the good news for Price County. His mom does not live in Price County anymore. So change of venue if she stays put in this other county. She's been there since April 4th. So at 6 months, and they're well aware of it already, at 6 months-ish, we will be change of venue and it will be on them. Good for Price County, still bad for this youth.
Yeah, that's good, but it's still sad that
Mhm.
individual has these issues.
Yeah.
Oh, wow. Thank you.
Just a question, Kayla, Paula here. What happens if you can't, nobody can control him? Where do they go with him?
I mean, honestly, like we just keep limping along with this placement. Although, I mean, I just think that the support that the worker is providing helps a whole lot. To take the calls after hours and on the weekends and stuff. I don't know. But I mean, we were talking about it because we talk about, it's a QRTP placement as well. So that means that we have to explain why a child is in such level of care to the state as well. So I'm like, what would we do? Like, we're trying to brainstorm, if tomorrow this home says I'm not keeping him anymore, what would we do? And we were just talking about it, and they said, well, honestly, we'd try this type of home, but likely they wouldn't be able to control the youth. The worker went to do a visit with him, and he took off on the worker, and they just kind of followed. And the good news is he's now established this place as kind of home. So he went home instead of somewhere else that was more dangerous, and they seem to handle that better than calling in runaways. But I don't know. I don't have an answer. We had a home he was in So prior to this, he was also in an assessment center, which is really expensive as well, but it was a very good assessment. He doesn't function at the level that he should as far as age and whatnot goes. We haven't found any family members. There's a foster home that had him for a little while that did a really nice job with him, but it was a short period of time, kind of like a honeymoon period. And so I honestly don't know what we would do next. We would be scrambling.
Wow.
Madam Chair, may I make a comment?
You may.
Just something like this that's open-ended, so to speak. What if we had 2, 3, 4, 5 of these individuals?
Bring
I
the
mean,
county. Oh, my
the
goodness.
county would go broke. I mean, I know you just said that you don't know what would happen, but can you look into that, find out what other counties do, if there is any alternatives? Because having it open-ended with such high costs, there should be some kind of plan in place or alternatives.
I understand. What I would say is that
I'm not putting this on you or anything, but I think it's something we should look into because if we get
I can kind of step in on this. What other counties have done is looked outside the state. There's a few places that would take this child, but it would be a significant high cost to our, so it'd probably go up to a residential, but I'm assuming we would probably look outside the state.
And
And
when it comes to like budget, so right now, all of these costs are our operational costs, so we take it out of our levy. There is a state statute. So again, we're always going to be on the hook for the costs, whether it's in, I know some counties go down to like Louisiana and Missouri and all these,
Tennessee is a big
Yeah,
place.
Tennessee.
well, either
big
way, you're
cost.
still paying for it.
right, we're still
Doesn't matter
paying
where
for
it
it,
is.
but
Exactly.
under the state
Exactly.
statute, what happens is if a judge orders these things, we can use debt. So you can say, oh, operationally, it's $200,000 a year or 250,000. Obviously, we can't handle 2 of those, 3 of those. So you as a county are still on the hook for it. However, you can borrow money, which takes it out of your general operating levy. So you're still on the hook. The money is out. You're always as a community on the hook. It's just a matter of where we allocate it. So it doesn't take away from us being able to do other services, whether it's road work or whatever. So we're never not liable for the cost, but we have tools to raise the levy based on a judge's orders.
I would also say that I know that that can happen, but every situation, every youth that we have is really unique. So we might have a youth that has that high of needs, but they do have an appropriate family member that is willing to work with us and do these different things. Or you might have a different set of services, and like this family just does not have, we can't find anybody that is. So we do have other kids that are super high needs and high risk and whatever, but we have other avenues that we can explore. Just no situation is the same. The mentoring, someday we'll talk about that maybe, but we have a little bit of money that we use for that. That helps a lot. I mean, I have a list of like 12 kids that are in rough shape, but we have some funding that we use for like mentoring or that TSSF funds. This kid just is above that. Like there's, we know of all those things and we try. So, on a positive note, the next one that Bob had emailed about.
Can I ask one more question?
Sure.
How old is this youth?
15.
So we would have him in our children and youth till he's, I'm saying he, I don't know if it's a boy or a girl, but till they're 18?
Yes.
And then what happens if the problem still exists at 18? Are we still dealing with this person, but in a different unit?
Yeah. Yeah. I don't believe this youth would ever be able to live on their own.
Wow.
Mhm.
Wow. Thank you. Okay, go ahead.
Yeah, I was going to ask, in other situations, kids age out. So would he age out or would he become a ward of the state? What are you saying?
So again, every situation is different. So like this youth would be, I would believe, have a cognitive disability that would be very low as well. So he would likely at 17 and a half start working with Aging and Disability Resource Center to like get on that. And then they try to work with youth to get them to be the most independent that they can, but he would then move into that system. But on a positive note,
Yay.
Bob also asked about the next one, which is another high cost, Family Services of Northeast Wisconsin. And that is a residential care center, $15,126. That youth has been a shining star there and is doing really, really well. And that youth will be coming home at the end of the month, we hope. So
Nice.
that's positive.
Nice to end on a positive note.
Yeah, I think so too. Any
This
other
takes our breath away, I think, just, yeah. Okay,
I was gonna say, I will say Kayla and her staff and everybody over at Health and Human Services does a great job trying to mitigate these type of costs. I am on a call every Monday and we hear about horror stories of other counties that they're hitting millions of dollars with 2 or 3 individuals because like what we're dealing with, you can't put them in a facility because they want to hurt everybody, and they can't take them out of the facility because they want to hurt everybody at their house. And so now you're $40,000 a month or $50,000 a month. So we're not unique. That we're lucky. We have great staff. I'm assuming they all have great staff around us. I'm not saying they do bad anymore, but it's a lot of work to manage these situations, and we do the best we can. So
Well, I think they all do a wonderful job.
yeah.
Just the system. The
Yeah.
system needs to be revised or
Yeah, and I don't even know if the
reinvented to-
system, I can't even say the system's broke because
Well,
what do you do?
they
It's
do
just
their
a high
job,
cost.
but
Yeah,
but how it's funded and
yeah.
at what level.
And there is some positive, there's a positive part of this with funding for some things the state has changed. So whether you like left or right, the state budget originally had prices going from $1,500 a day to $2,500 at some facilities. Governor Evers vetoed the 2, so now instead of going from $1,500 to $2,500, it's going down to $500. So the state is taking on the burden of the cost. So it's actually a reduction per day for 2 different types of facilities. So we'll talk more about that later. But there was a stroke of the veto pen that will help a lot of counties out with funding. It's priority next year. That's what I've been told, or the next budget, but starting next year to look at this type of cost.
any other questions for Chris Ann?
There's a couple more that
Oh, a couple
Bob
more?
had.
Okay.
Get my computer back up.
Thank you, Kayla.
So there was a question, we had a couple expenses totaling about $28,000 for, it was for training guides, and it was through the Wisconsin Juvenile Intake Association. Sarah knows about this a little bit more, but we're kind of like the fiscal agent through this association for the state to handle the grant funds. So we spend the money on the training and different stuff for the state, but it's fully reimbursed by a grant. So it's in and out, it's a wash. Nothing is, it's not an expense to the county. There was a question on Aurora Residential Alternatives. That's a community-based residential facility for a behavioral health client. There is an expense for about $6,600. That client is no longer at that facility, and he's moved out of the state, so we won't have that expense anymore. And then the final one you may have seen, there were a couple invoices from Taylor County for CCS, which is our Comprehensive Community Services Program. It's for behavioral health clients as well. They bill us for services like psychotherapy, psychoeducation, skills and development training for clients. And that's, again, totally 100% reimbursable program for medical assistance. So they bill us for the services they provide. We pay them. In the end, medical assistance makes us whole. What we don't get from medical assistance, we claim the next year through WIMCR, which is our cost settlement program. So it's, again, something that's all taken care of in the end. So nothing should come out of the county funds.
Thank you.
You're welcome.
Okay. Any other questions for Chris Ann? Okay, thank you, Chris Ann. Okay, so now you have the vouchers in front of you. I'm looking for a motion to approve, or
I'll motion if nobody else did.
Mr. Kopish. A motion to approve,
I'll second.
and Patty Stephen, second. Any questions about that? Any other discussion? Hearing and seeing none. All those in favor?
Aye.
Those opposed? All right, they're yours now, Chrisanne. They went somewhere. Oh, they're up there. And thank you. You have the minutes in front of you as well, looking for a motion to approve, not approve. Mr. Swenson makes the motion.
I'll second that motion.
Mr. Baratka seconds that. Any discussion? Hearing and seeing none. All those in favor?
Aye.
Those opposed? Okay, minutes are passed. All right, Public Health Unit, Tiffany Polachek.
Good morning.
Morning.
All right, so kind of shifting gears to public health and a little maybe more of the prevention side of things. So just going to highlight some of the areas here on our report. Communicable disease in the second quarter. You can see we did have a decrease in overall communicable disease, but where our higher numbers were of course in those tick-borne areas, which we usually expect to see come springtime and in the summer. So, but seeing some of those other areas decrease. Maternal child health. Our WIC numbers have gone down just a little bit. Sometimes that just kind of, we do a little bit of an ebb and flow with that. We did receive the farmers market vouchers. So those are starting to go out to the families. Our prenatal care and case management numbers are increasing. I have to give a shout out to Morgan, who is our new public health nurse. She has hit the ground running and providing the prenatal care coordination services to high-risk moms. With her background in OB and her being from the area, she knows resources. So that has been just a huge, huge thing for us in public health. So she deserves a lot of credit for that because she's done a lot of outreach with it, and she's we can see it. The services are getting to those that need it. That includes case management as well. And reproductive health, we're seeing about the same. Just down just a smidgen, which we see an ebb and flow with that. Environmental health, we had 3 housing complaints. 2 of those closed, one that they're still trying to contact. We're still trying to contact an individual. Nothing for radon. The elevated lead cases that we had, we were able to close out this quarter. We don't have anything new for abnormal lead results. And our dog bites were pretty much the same in the second quarter. However, when I give you the next report for the third quarter, you'll end up seeing that those are going up. In the summertime, we tend to see that those dog bites do go up. So we are trying to get more and more word out there of the importance of getting the rabies vaccine for your pets, and then also letting individuals know what it means for your pet if they do bite, including what the cost of that is, because sometimes that is a determining factor in kind of encouraging people to have their dogs vaccinated or their cats. So preparedness wise, we participated in a couple different activities. Michaela and I were part of the medical response and surge exercise. So we worked with emergency management. We were given a scenario on if there were to be a larger event with some issues, how we would work with the hospitals. And what we would do here, like setting up a family assistance center and things like that. Then to follow up with that, we did a Red Cross mass care shelter workshop with Health and Human Services. We had Red Cross come in. They worked with all the public health staff and then the supervisors from each of the units in case there would ever be where we had to open up a shelter in the area. So that was really, really good because they showed us how we would get things up and going until Red Cross would get here. So off of that, Michaela is now going through all of our plans, making sure everything's updated so that we can do even maybe another walkthrough in the future. So just to have that comfort level, as we can see in areas, as we watch the news all the time, you never know when something is going to occur. So we, as part of our preparedness, that is something that we are working on. Yes.
Yeah, just a question. When you get to where you've got that all done,
Yes.
everything's updated, would you share with us kind of what the plan is? Because I get asked questions on this and
Yes.
I can't really answer it.
Yes, most certainly. I'll actually have Michaela probably join me for a presentation on that then, if
Thank
that's
you.
all right.
Yep.
Yep. And then along with preparedness, just doing our summer safety education. our Fight the Bite with our tick education and tick kits. If you get our public health update, which I believe I send out to everyone here, you'll see that we did put out some information on that. So there are kits that are available in our public health area downstairs of the normal building, and we will be providing these at expos and the fair and things like that. So it has a tweezers in here for safe tick removal, alcohol wipe to kind of disinfect the area. There's a little baggie in there so you can save the tick for identification purposes. And there's instructions and everything along in there. So I brought some along for everybody so you can take them home, whether for you, for your kids, grandkids, and such. And then we also have the Beat the Heat campaign going on again, where we provide education. And then we have the Price County water bottles that basically say Beat the Heat, and we'll be providing those at our expos and such as well. And those were all covered by grant funding, either through preparedness or communicable disease. And then the community needs assessment portion, our Health and Wellness Coalition. I think if you recall, the last time I gave a quarterly report, we had kind of talked about the after school program. It had gone into the second quarter as well. So at the Phillips School, JoJo and Morgan did an excellent job working with the after school program kids on personal hygiene and health education in one session. And then they followed through with some healthy eating choices. So they had done their education and then did a hands-on portion with it where the kids could even test out their skills by making their own charcuterie boards that night with healthy food options. And then they had a parent session afterwards where they could bring in some of the education from the Substance Use and Mental Health Coalition of for Hidden in Plain Sight. Going off of that, with the Mental Health and Substance Use Coalition, their participation within the after school program, they did those two girls also did the Escape the Vape campaign, and they actually didn't escape the vape escape room. So they gave clues and activities to kids. So during all of that, they were learning about the harm of vaping and how to say no to someone who would be offering them the vape. So that was pretty good. The kids were engaged. They had a lot of questions afterwards, and then that's when they had allowed for more discussion, engagement, and parent opportunity. And then just overall as an agency, we continue to do our education and prevention through our update on our newsletter, our Facebook page. And then we did have some sophomores from the Schwamigan School District come and do a job shadow in public health. So I included a couple pictures of that and how they had them all garbed up in all of their isolation gear and everything like that. We did receive response back from the students. They all sent a handwritten note thanking Morgan and JoJo for taking the time and the education that they learned. So, and then just to give you an overview of immunizations we provided during that quarter, that's on the very back. And that's all I have.
Any questions for Tiffany? Thank you. That's always very important. Thank you. All right, let's move on to Aging and Disability and Senior Services Unit. I see Dawn is here. Chris is not going to be here.
She's
Okay.
meeting today.
Okay. So Dawn, it's yours, Dawn. First one, Aging and Disability APS. Hi.
There we go. I always forget to put that on. All right. So looking at the quarterly report that should be in your packet. So the ADRC specialist, that usually remains about the same. And it really didn't change much this past quarter. It's been pretty steady. So moving down to the dementia care specialists, with the support groups, I'm really encouraged because it seems like we're getting more people to participate in each quarter that I do this report. It seems like we have a few more. So I think that's a really good thing for our community. And even the virtual support group, we're getting a few more members. So that's really great. And then the Powerful Tool for Caregivers class, he had 6 attendees this past spring. And so he'll be doing one again in October. So hopefully that kind of stays steady, or we even get more people to attend. That would be great. So again, that's a really good thing in the community, helps people to care for their loved ones, keeps them out of placements and adult protective services needs. So that's a good thing. And then the dementia-friendly training, we will be doing that this fall with all of the aging and disability senior services staff. So we had planned it for June, but it did not work out. Shay ended up, some of the people couldn't come that day, and then he ended up having something else he needed to go to also. So it just wasn't a good day. So we are rescheduling that, and that will be taking place probably in August or September. And I do want to wait until hopefully we hire a new DBS person to do that, and then she or he could attend that also. So let's see, member screening events continue, and we'll be at the nutrition sites in August. We have done some outreach events, and we do have some other ones coming up. So we'll be attending the Veterans Service Day in July on 16th. Do you remember, Sarah? Something around that. Yeah, 16th, 18th, something like that. So we are going to have tables for the ADRC at that. And then we have our Senior Living Expo this fall in October. So we're very excited about that. And we'll have a presence there as well. And so then moving to the back page, you can see the disability benefits specialist handles 36 cases over this last quarter with a monetary impact of $259,300. So monetary impact, it kind of describes it there. And so that is money that position is bringing back into the community by helping people to apply and receive benefits so that they're not using county resources. So that's a very important position, and we're excited about getting that filled again. So then Adult Protective Services has been very, very busy this past quarter, specifically in June. We had 2 emergency protective placements in June. So that would be 2 placements to Clark County. So we did have some costs associated with that for June. So hopefully that slows down a little bit. But yeah, June was a very busy month. Rhonda and Jordan were really running in June. So we're hoping that might slow down just a little bit for July. So yeah, with the Adult Protective Services, I guess the good news is that I was able to apply for some ARPA funding, which we did receive an award letter just yesterday. So that will help with some of those costs and help with getting a couple of new laptops for Jordan and Rhonda, since theirs are over 5 years old. So that was the good news, is that we were able to get that extra funding. Any questions on that? No? Okay. So then, can I move on to the governing board meeting then, Paula?
Sure.
Okay.
If there are no questions, sure.
Okay. Okay. And you were at the governing board meeting too, correct?
I was online, yes.
Okay. So if I miss anything, you'll chip in?
Well, I will.
Okay, good.
Tasha sent me the minutes from there too, so
Oh, good.
yeah. You can always ask her for those. I should actually CC you on that when I ask her for the minutes.
Oh,
Because
all right.
usually we get the minutes, they're out before we have another meeting. So it's just, I always do that because maybe I might miss something that was discussed. So
Okay.
I'll just make sure that she sends one to you then as well.
Okay, that'd be great. Thank you.
Sure.
All right.
I'm sorry I didn't think of that sooner.
Okay, so with the governing board meeting, we discussed some openings on the board and went through the financials. It seemed like and I'll admit that I'm not the best with the financials yet. I am still learning, but it didn't seem, from what I was understanding from the board meeting, that there was anything really out of line with last year's financials, that they were pretty much as expected. So the main thing I got from that is that there was some leftover funding from the allocations. And so that was used to reimburse the counties for indirect expenses And I understand from Carrie yesterday that we did get a check for our portion of those, which according to this, and let me know if that's not right, but I think it was 15,577 we got. So that was our portion for the leftover money to cover our indirect expenses related to the allocation. And then my understanding is the rest of that money was put in the ADRC of the North contingency fund. Is that, Paula, is that your understanding as well?
That, I'm looking here, yep, put the remaining in the contingency fund, yes.
Okay.
Yes.
So that was my understanding of the discussion related to the revenue. I know there was some discussion about the 2030 focus group, and Natasha, who's the ADR from Ashland, the ADRC of the North, has been selected to be on that planning group. So I think that's a good thing, because then our area has a voice on that group. So that was great. Branch updates was a lot of discussion of kind of outreach events and different things that the counties are doing. So that's always good, because it gives you ideas, that you might for next year, things that other people are doing. And then there weren't a lot of Pure Place updates from what I recall. And I don't know that there was much for tribal updates either, from what I'm remembering.
With the Pure Place, which is that program for documentation.
Yes.
So that's, it's new and it's statewide. So
Yes.
they're working on getting that going.
Yes.
They're getting more comfortable with it.
And there's been there was a lot of errors in entering resources in that. So locally, Brenda Baldwin has been working on a part of a work group to get all that cleaned up and make sure that the resources are correct for our area. So she's been going through them all, correcting them, and working on that. So that's been going well.
Yeah, I understand. Well, and they talked about that, and it's also mentioned in here that, are you having problems with the county with the program with the Pure Place at all?
Not as many as there used to be.
Okay.
So it's getting better. But it is, it can be confusing. And I'll say, when I started learning it, it's confusing. So it takes some getting used to as to how it, how you're supposed to document different activities and kind of even the verbiage of it. It just takes some getting used to, but they're getting much better at it.
From what I was hearing, and I think what I wrote down too, and I see it's in here also, that is long process and time consuming. Do you find that to be?
I find that to be true. Yes.
Well, hopefully that you can get all that together.
Yeah.
Tasha said that there was something about possibly finding a different portal for the Pure Place to see if they could have an easier access. You haven't heard anything about that
No,
yet?
I
Okay.
haven't.
Maybe we'll hear that in the next time. And we're still struggling to get any representation from the tribal units.
Yes, that is my understanding.
That's been an ongoing. So I have nothing to add. That was a good report that you gave.
Okay, thank you.
Any questions?
Yeah,
for
questions?
Dawn this time? Okay, thank you, Dawn.
All right.
Well,
You're welcome.
is there any more on aging or not? Because I see Chris was on here and she's not here. Is there stuff, because I got some stuff in the packet that
That's, I'm gonna talk.
you're
about
going to take care of that?
Yeah,
Okay,
Sarah
all
will.
right, thank you.
Okay,
All right, thank you.
thanks, Dawn. All right, so Kayla is not here anymore. We'll just look at hers.
Oh, yeah, she had to.
She had to book. I know she ran, so is there anything in here that we,
So we have the
yep,
quarterly report.
has the little blue,
So this is the Children and Youth Quarterly Report. Should be 3
it's
pages.
in your packet.
Yep. And nothing really has changed on these quarterly reports. It's pretty much the same of the first page of giving what the second quarter looked like for for 2022, 2023, 2024, and then 2025. So, and then the black is the out of home are out of county, and the blue is the in county, which is family, kinship, foster homes. And then the next page is the second quarter placement types and costs, which Kayla had just gone through. And then the third page is the costs and where we're at the second quarter. And then first and second quarter is split, as you see on the right, bottom right. We have 2022, 2023, 2024, and then first quarter for 2025 and second quarter for 2025. So unfortunately, cost is increasing here.
Oh, gosh. Any questions for Sarah on that? Okay, behavioral health. Chana.
Okay, behavioral health, yes, yeah. Behavioral health is the next 3 pages with the chart. Yeah, the chart. The first chart is the crisis calls. And like, again, there's nothing been changed or added differently to these. So you guys have seen these before. I don't know if anybody's had any questions regarding the crisis calls. I know they've been up, as you can kind of see, they've been up as well. And then the next page is the behavioral health programs, the ISP, the CCS, then the CSP and the CST. And those are what we have in the programs at this time. Our CCS has grown considerably. I mean, from last year, we've had like 2 families, and now we're up to 15, which is great. It's really been helpful, and it's also been helpful for the children and youth families as well, finding services. And then our next page is the children's waiver and birth to 3. Again, I have to really give a lot of compliments to Bobby Joe. Her caseload, as you see in this children's waiver, she's up to 53 cases. And again, as I mentioned before, a normal caseload is 24 for a normal caseload for somebody to handle due to the amount of paperwork and whatnot. So I know that we're going to have to kind of start thinking or considering if this continues to increase, she's not going to be able to handle that amount of cases and provide that amount of services for the families. Any questions?
Yeah, just one.
Sure.
Just so I understand, on that first page,
Okay.
you've got a column for transgender or non-binary. Is that a requirement, or isn't that just a person? Isn't it like a person like everybody else?
Exactly.
Why
It's
are
just
we
that That's what the state has.
The state requires you to do that?
That's why she has that on here. I know.
I some of this stuff I just don't get. I'm sorry. I'm not being critical, but I just, why segregate? I don't know. Okay, thank you.
You're welcome.
Any other questions? Okay, so now,
Okay.
or you know,
Me.
economic support, Sarah?
Okay, the economic support, where also the 2 charts have the colors on here. What they have developed is Price counties and then also the Northern Income Maintenance second quarter. So you can see the overall calls for the Northern Income Maintenance second quarter. What the calls are received per week. And then if you go to the Price County, you'll be able to see the case counts, the recipient counts, the food share amount in Price County, MA cases that our workers are working with the cases. If you have any questions,
Patty has one.
Oh, sure.
Go ahead, Patty.
When it says food share issue amount, is that like food stamps that we issue, or do we coordinate with that,
That's
the
what we-
St. Benny's Food Bank? They do Tuesdays and
This all has
Saturdays.
to do with, that's totally opposite. This is where they apply for food share.
Okay,
So they apply for that.
okay. So that goes to the people as a coupon and not purchasing food for a food bank. Is
Correct.
that
Counties
correct?
cannot contribute to food banks.
Okay, okay.
You cannot directly give funding. You can have a contracted service,
Right.
to be clear, but we can't just say we're giving a $5,000 donation. So we do that with Embrace. So we can't give Embrace money, but Embrace provides a service for Health and Human Services, which we have a contract for. So if there was a contracted need, then we could. But this is a different program.
Patty, were you referring to the center right next to the credit union? Okay. Right,
Yes.
right.
I mean, those are ones that come in to ask, do you have any cards for pick and save? And then we give them the next to the food bank. So there. But this year they have to apply for, and it's quite a bit of paperwork and what they have to take in.
Okay. Now, Carrie?
Not very.
Okay. Carrie, Fiscal Administrative Unit.
Yeah, I will do that.
Okay.
Okay, good morning. So you'll have the high cost placements for children and youth. I feel like Kayla did above and beyond an excellent job explaining a bunch of those costs and some of those things that you were questioning. Those are embedded into these numbers. If you are going and you look at the high cost placements for behavioral health, this doesn't always happen and it does happen sometimes, but you don't always see the difference on these reports, where in April it was higher and then in May it jumped down. So that will sometimes happen for clients that are maybe at like Winnebago or Mendota. We get billed for that, and then if they bill their insurance and like MA reimbursed it or whatever, then we get that back in a positive amount. So that's why you do see that little difference there. So that was exciting to have something cool to talk about. Yes.
Still positive.
Any questions?
I don't see any.
Perfect.
Okay.
Thank you.
Well, thank you. And let's go back for juvenile placements going from
I know.
500 to 2,500.
Yeah, I know that Nick had briefly touched on this, but on June 27th, the Joint Committee on Finance increased the daily rate for juvenile corrections to $2,501 for a daily rate for 2025 and to $2,758 for a daily rate for 2026, 2027, which is meaning that's an over increase of $1,000 a day. It's a day. And I know that they had contacted directors and county administrators and to say, hey, call your senators, I mean, this was just kind of all of a sudden. Then what happened is on July 3rd, the governor used a partial veto to reduce the rate to $500 a day, which is a decrease from the rate, what actually was. The actual rate was $1,268 a day, but the governor had reduced it down for 2026 for $501 a day, and then in 2027 to $758 a day. If they would have continued, as my understanding too, it would have broke all of our counties.
Yeah. So what everyone went to governor before the veto with was, okay, we as a county, if we have one or two of these individuals, it'd be $1 million a year. You can't as a county, no county can
Right.
take this on. So we didn't know what was going to happen. We were all very happy when the number 2 came off the front and the number, I think it was 1 on the other one.
Yeah.
But either way, the front number came off, reduced the cost. So takes off from us. My understanding is about $40 million that the state will have to come up with. So the Department of Corrections or Justice, I can't remember.
Department of Corrections.
Corrections. So DOC has to come up with the $40 million to offset the cost. So if we send someone there, it would have been $2,500. We're paying $500. The DOC is going to have to come up to keep these facilities open. This all stemmed from, was it 4 years ago or 5 years ago, when legislators said, "Oh, you counties, you can make your own your facilities, regionalize, we'll help you pay for it. But if you go over a certain rate, we won't help you pay for it." And so none of the counties took on that, and they slowly started to find different facilities, and facilities closed. So how they came up with this 2,500 is they said, on average, we have 50 people a day, but we need to staff it, blah, blah, blah. So we divide it by the 50 people. It costs us 2,500 to run the facilities. So again, positive. Still, the state has to come up with the money rather than the counties. It's one time the mandated service was taken on by the county, or by the state. So that was a good for us fiscally. They still don't know how they're going to deal with the facilities in 2 years because no one wanted to open a facility to take on this stuff. So does the state reverse what they were doing 4 years ago and say, do we need to build and make sure these facilities are maintained? That's yet to be determined.
So this is Lincoln Hills?
Lincoln Hills and the one in Milwaukee.
One in Milwaukee.
Yeah.
But the Grow Academy is a little bit of a different program, but
And none of the counties decided to do the regional.
No, there was Brown County was going to do it. Washington County looked. There was, I think, 6 counties looked at it, and they said to the state, "We'd be happy to do it as long as when we have an overage, like if all of a sudden it starts to cost us more, the state would kick in." So maybe up front it would be cheaper for the state, but eventually you're going to need some subsidy to take on this burden that the state's trying to get rid of. And the state ultimately said nope. And so these counties said, "I'm not going to take the $1 million grant to build a facility if you're not going to help me with operational costs in the end." Because we can't just go back and charge counties $3,000 a day to do this. It's not going to work.
It's a head shaker. That's for sure. All right. Let's move on to, if there are no other questions for Sarah under that portion, we'll move to Sarah with the director's report.
okay. Since Chris wasn't here and we were talking about the aging and disability senior service programming. That's what you have in your packet. And I just asked her if I could just get a copy to give out to you guys so that you could see the programs that they are providing for our community. So that was just kind of an information for you guys to look at. And then Chris will be here for next week for her quarterly report.
So this first one, the Alzheimer and dementia, is that Shay?
Right.
And
yes.
he used to be at the Peace Center once a month. Now he's at the Waterford?
Waterford.
Okay. Probably a little bit less obvious being there than, because there's more people going in and out dealing with those issues.
Right.
Yeah. Okay. Okay, thank you.
Participants, like, so if you go, you're not, "Oh, look, they're going there for the Alzheimer's thing." It's just, "Oh, you're visiting someone." Or, yeah. At first I thought you meant less obvious, like no one will know he's there, but you're saying for the participants. Yes.
More in line with this.
Yep.
Yeah.
What's going on?
Also is the agency we've been working, we'll have our annual report done for you in the August. Carrie and I have been busy meeting with the supervisors on working on the budget. And we'll be finishing that up today with the supervisors. Just, I will bring more information back, but just in case you've heard is, Forest County, will be leaving our Northern Income Maintenance Consortium and, next year. And then I will bring back more information in August for that of reasoning and what's happening with
Where are
that.
they going?
The state will be.
Okay, okay.
Think that's Nicole, for our nurse practitioner, Nicole Kowicki. I will be meeting with her to see if she would be interested to be sitting in our committee and our board. Works at Tailored Health right now, but she'll be leaving Tailored Health and going to Barry Weinmiller. Is that what it is? Barry, yeah. So she'll be going back there. So I'll be meeting with her to see if she would be interested in sitting in our board. I don't have anything else with that. Agency updates. The ad hoc committee for opioid funding. Tiffany and I have been meeting, and we have kind of been gathering information from other counties. We have pretty much worked on and developed our opioid committee. The only thing is that we have a lot of, we'll have the direct, myself, we have Tiff, we'll have Chana for behavioral health, Kayla from children and youth. We'll have Jojo from the coalition. We have the Nick from office admin. We'll have the Health and Human Service Board designee, Marshfield Medical Center, a designee from there, Aspirus, a designee, probation and parole designee, somebody from the Price County Sheriff's, Phillips PD, Park Falls PD, and then somebody from the 3 school districts. So Tiffany, I will be going and meeting with them and discussing what the opioid committee is formed and what we're looking for. So we'll be looking at that.
Yeah, so I asked Sarah to come up with this list of positions. She named people that we've already kind of identified that would work well with it. The executive committee will have a resolution, hopefully for the next board meeting, which is in August, that'll say we're creating an ad hoc committee. It's the opioid committee. These are the positions. This is how the appointments happen. And why we need this is in order to spend any of the opioid funds, you have to have a committee that recommends the spending to your board. So through committees and boards. So once we come up with the resolution and who appoints it, then we'll get that all settled in. We wanted to bring it here today just so you guys kind of know what the structure or the people that would be on it, what we're thinking. Is there any thoughts, questions, concerns? They probably will meet 3 times.
Yeah.
Once to just, here's what we're doing. Second one is, okay, here's how much funding's coming through. And a third one is make recommendations on how to spend it. It'll stay together for a while because we do have funds coming for a long time, but really we just need to establish how we want to distribute those funds. The other opioid resolution you'll see is on the next executive committee or for the next board meeting is we have to pick a designee to do all the signing of the settlements. So we're starting to see a lot of the individuals that were named in the lawsuit settling. So like Kroger is settled for, I don't know, it was like $100 million. I don't remember the numbers, but they've settled and said, instead of 20 years worth of payments, we're going to do 2 lump sums. Do you agree to it so that we get more money up front rather than for the next 20 years, we get $2,000. We're going to get 20 up front instead of 40 total. So we have to designate in a position, whether it's the board chair, myself, finance, whoever. It's just, we get these lawsuit settlements all the time. It could be corp counsel, whoever, that we just need to be able to sign off and say, yep, we accept the settlement. We really don't have a lot of choice. It's not like, oh, we don't agree with it. We've paid a group for the state to do this for us.
Any comments? Okay. Personnel updates. So you'll bring that back to the next meeting?
Right.
Okay.
Personnel, our family skills worker, will start July 14th. Our health and human services assistant starts August 12th. And then we have interviews for our disability and benefits specialist tomorrow. So, things are looking pretty good.
That's good.
For positions.
Did you have very many applicants for the disability benefits
We
specialist?
had probably about 7 and about 4 that qualified for it.
I think that's good.
Yeah, that's good.
Yeah.
What's that?
I said we're moving back up. So
Yes,
for a while we were getting 0 to 1 qualified, and now we're starting to see some good applications.
Exactly, yeah.
Okay, no other questions for Sarah? Okay, before we end, I do want to make sure that I thank you all for being patient with the Health and Human Services Board when there was just a little snafu as far as the leadership of the committee, and so nothing could happen because both Bob and I we were just like out. So that's why there were cancellations, and I thank you, Brian and Nick, for taking over when it came time for the agenda and everything. So appreciate that. So with that, our next meeting will be August 13th in 2025.
And remember, that's going to be an afternoon one.
That's
for
right. That's
public
it.
participation.
Afternoon. Put that in your book. It's at 3 o'clock is the meeting, and
Yeah,
then
that's-
5 o'clock. So the meeting is at 3, and then depending on how long the meeting takes, and then we don't start up until 5 o'clock for the public participation, which in the last couple of years has been 3 minutes, 2 minutes, so 4 minutes. Yeah, have to read it all, right? So hopefully we don't have to carry on with that too much. So just make sure you mark that. And I know, Meredith, when you put that in, make sure you highlight those times for everyone to remember. So.
3 o'clock.
Yep, 3 o'clock and then 5. All right. So with that being said, hearing and seeing no concerns here, meeting is adjourned. Thank you all.